Have you noticed your body changing after 60? Maybe things feel a little less full, a little less firm. You might even feel like your confidence is shrinking along with it. The truth is, it's not actually about a loss of size. The real culprit is a vital group of muscles that has simply gone dormant over the years, impacting blood flow and your overall prostate health. Hello, I'm Dr. Kara, a men's health specialist with over 2 decades of experience helping thousands of men in their 60s, 70s, and beyond not just regain their physical health, but rediscover their youthful vitality and confidence. Today, I'm going to share a simple 3-minute fix that has helped hundreds of my own patients get their groove back. No pills, no surgery, just an understanding of how your body is meant to work. Before we dive in, do me a favor and comment yes down below if you feel like your energy and confidence could use a boost. And please hit that subscribe button and ring the notification bell so you don't miss out on any of our valuable men's health content. Stay tuned until the end of the video. I will reveal a little trick that will help you double your efficiency and regain your confidence quickly. Now, grab a cup of coffee or tea, get comfortable, and let's get started. You may have noticed that things just don't feel the same after 60. Maybe your erections aren't as firm as they used to be, or you feel like your penis has started to look a bit smaller. If so, you're not alone. This is a very common concern for men, and I want to explain exactly what's going on, because it's not what you think. The truth is, your actual penis size isn't shrinking. What's happening is a change in your body's support system. As we age, a few things occur. Testosterone levels naturally decline, and we tend to become less active. This leads to a weakening of the pelvic floor muscles, the very muscles that support your bladder and your erection. When these muscles lose strength, they can't effectively trap the blood needed to create and maintain a strong erection. This results in less rigidity, a droopier angle, and a penis that simply looks less full or smaller than it used to. According to the American Urological Association, more than 40% of men over 60 experience some degree of erectile dysfunction. Now, a common mistake I see men make is believing that pills are the only answer. While they can be helpful, they only address the symptom, not the root cause. This reliance can make the underlying muscle issue even worse over time. The good news is you can start to address this today. Think of your pelvic floor like any other muscle. It needs exercise. One simple tip to get started is to incorporate more blood flow boosting foods into your diet. Foods rich in nitrates, like spinach and beets, can help your body increase blood flow naturally. It's a small change that makes a big difference. But if we stop there, you're only seeing half the picture. The real magic happens when we fix the foundational issues that are creating these symptoms in the first place. Next, I'll walk you through the single biggest mistake men make that makes this problem even worse, and what you can do about it. Do you find yourself spending more time sitting these days? Maybe at a desk, in front of the TV, or in the car on a long trip? It's a common part of aging, but it's also one of the biggest silent culprits behind the issues we just discussed. The problem is that sitting for prolonged periods essentially turns off your pelvic floor muscles. These muscles need to be engaged to stay strong, and when they're not, they weaken, leading to poor blood flow and a decline in erectile function. This is especially critical for men who have undergone prostate surgery, as the pelvic floor becomes even more vital for regaining control and function. Another common mistake I see is a subtle but powerful one: incorrect urination habits. Many men subconsciously strain or push to urinate, thinking it's faster. In reality, this weakens the bladder and puts unnecessary stress on the pelvic floor. It's a habit that can contribute to a host of issues, including poor bladder control and a loss of erectile firmness. Finally, while many men turn to medication like Viagra or Cialis, relying on these pills is a short-term fix.
They might address the symptom, but they do nothing to solve the underlying problem of muscle weakness. In fact, over-reliance can make things worse by preventing you from truly addressing the root cause. This is a crucial point because, as a report from the Cleveland Clinic highlights, real, lasting improvement comes from a holistic approach. The good news is that recognizing these habits is the first step. You can start today by simply being more mindful of your posture and finding ways to break up your sitting time. Stand up, stretch, and walk for a few minutes every hour. It's a small change that can reignite those crucial muscles and pave the way for real, lasting improvement.
The big question now is, what can you actually do about it? The answer is a simple, effective 3-minute routine you can do every single day. The key is to start training your pelvic floor muscles. So how do you find them? The easiest way is to try to stop the flow of urine midstream. Those are the muscles you want to target. Just do this once to identify them, then you can practice anywhere, anytime. Sitting in your car, lying in bed, or even watching TV. The basic exercise is called a Kegel. Here's how you do it. Squeeze and hold those muscles as if you're trying to stop the flow of urine for about 3 to 5 seconds. Release completely for about 5 seconds. Repeat this 10 times. You can do this routine 2 to 3 times per day. Now, a couple of common mistakes I see are men holding their breath or tightening their stomach, glutes, or thighs. Don't do that. The goal is to isolate the pelvic floor muscles. Also, resist the urge to do too many reps. Overtraining can cause muscle fatigue and soreness. The point of this isn't to make your penis longer. Instead, it's about making it feel fuller, firmer, and more robust. By strengthening these muscles, you're improving your body's ability to support blood flow, which in turn leads to a more solid erection and a more confident look. This simple habit can make a world of difference in your health and your confidence. In the next segment, I'm going to share a few lifestyle hacks you can use to multiply the effects of this exercise. While the main reason you're here might be to improve firmness and confidence, the real beauty of this 3-minute habit is the unexpected benefits that go far beyond the bedroom. This exercise is about strengthening a foundational muscle group that impacts your entire body. One of the most immediate and surprising benefits is better bladder control. As men age, it's common to experience a weaker urinary stream or even some leakage, especially after surgery. By strengthening your pelvic floor, you're giving your bladder the support it needs, leading to fewer urges to urinate and a stronger flow. This can restore a level of freedom and confidence you may not have realized you lost. Furthermore, a strong pelvic floor provides stability for your entire core. Many men in their 60s and beyond struggle with chronic back pain. Often, this is linked to a weak core and poor posture. The good news is that by consistently doing these exercises, you can help stabilize your pelvis and lower back, potentially reducing that persistent ache. It's a simple, drug-free way to improve your posture and reduce pain. This isn't just about a physical fix, it's about reconnecting with your body. By engaging these muscles, you become more aware of your body's signals, which can even enhance physical sensation and pleasure. But if we stop here, you're only seeing part of the picture. These exercises are a powerful tool, but their effect can be amplified. In the next segment, I'll share how to combine this simple exercise with a few easy lifestyle changes to double your results and truly revitalize your health. We've talked about the power of the 3-minute pelvic floor exercise, but to truly maximize your results, we have to look at the bigger picture. Your health isn't a single action, it's the sum of your daily habits. Think of these lifestyle changes as the fuel that makes your engine run better. First, let's talk about nutrition. What you eat directly impacts your blood flow, which is crucial for firmness. I tell my patients to focus on foods that boost circulation.
This means adding more leafy greens like spinach, berries, and nuts to your diet. They are packed with antioxidants and nutrients that help keep your blood vessels healthy and open. A simple choice that supports both your heart and your sexual health. Next, let's address sleep. Many men dismiss sleep as a luxury, but it's where your body does its most vital work. As Harvard Health reports, adequate sleep is essential for maintaining healthy testosterone levels. When you're sleep deprived, your testosterone drops, which can lead to low energy, reduced libido, and less reliable erections. Aim for 7 to 8 hours of quality sleep each night. It's one of the most powerful things you can do for your vitality. Finally, managing stress is a game changer. When you're stressed, your body releases cortisol and adrenaline, hormones that constrict blood vessels and can make it difficult to achieve an erection. Simple, low-impact activities like brisk walking, swimming, or gentle yoga can help lower these stress hormones and improve circulation throughout your body. The key takeaway is that these changes are not drastic. They are small, consistent steps that build on each other. By combining a 3-minute daily exercise with these simple lifestyle habits, you're not just treating a symptom, you're building a foundation for lasting health, confidence, and energy.
If you start applying these simple tips today, you'll notice a remarkable change in just a few weeks. You'll feel firmer, last longer, and most importantly, you'll regain your confidence. Don't let your 60s be the end. See it as a new opportunity to invest wisely in your male health. I want to hear from you. Comment below and let me know which habit you're going to change first. I read and respond to every single one of your comments. And if you found this video helpful, please hit the subscribe button and ring the bell so you don't miss out on my next valuable health tips. Coming up next, I'll be tackling a topic many men are too shy to ask about, but is incredibly important: safe masturbation after 60 and when it's time to see a doctor. These are answers you won't easily find anywhere else. Click on the video you see on your screen now to watch it. Hi, I'm Dr. Kara. See you in the next video.